Cecile Richards is the president of the Planned Parenthood Action Fund and joins me now. Cecile, let me just start off by asking you, what did you think about the candidates' response to health care questions that came up at the last debate?
Well, I was really glad that Secretary Clinton spoke about the real benefits we've had under the Affordable Care Act. Planned Parenthood, we see 2.5 million patients every year, and many of them have benefited by now being insured or keeping their kids on their health insurance, or most specifically, 55 million women now have access to preventive care at no copay and no cost. It's been a dramatic benefit, but there's a lot more we need to do, and I think she spoke to that as well. Unfortunately, it seems like Donald Trump just says we're going to throw the Affordable Care Act out and start over. And again, I think there are things we need to improve, and Planned Parenthood is committed to doing that. But we need to build on the progress that we've made over the last 8 years under President Obama.
Is this issue of health care something that you'd like to see at this next debate?
I think it's important because certainly the difference between the two candidates is profound. Hillary Clinton, as we know, started out really even before she was in elective office working to get the Children's Health Insurance Program passed that now covers 8 million children in this country. It was really important, too, because it was a bipartisan effort. And again, I think that's what she can do as president, is bring the parties together. But there's a lot more to understand about Donald Trump and the differences there. You know, Donald Trump has said he would defund Planned Parenthood. His running mate, Mike Pence, has said he wants to put Roe versus Wade on the ash heap of history. And Donald Trump is also committed to appointing justices to the Supreme Court that would overturn Roe versus Wade. So I think for a lot of women in this election, our access to health care and our rights are very much on the ballot. I think that's why you're seeing women in extraordinary numbers now leaning towards Secretary Clinton, and why I believe we may have a historic gender gap in this election.
Those issues that you just mentioned, are you looking for some specific changes with the next president coming into office?
Well, I think one of the things that Hillary's talked about, of course, is we need to do something with immigrants and make sure that immigrants can actually get access health care. And there's still a lot of disparity, and there's issues with costs and pharmaceutical drugs. She knows these policies inside and out, and she has been fighting for health care equity her entire lifetime. I have such confidence that as president, she will surround herself by people who can move us forward in health care. I think that having the rhetoric that Donald Trump has had, of course, we've seen the Republicans in Congress do nothing but vote against the Affordable Care Act and vote to overturn it. We've never seen an alternative. And so again, I think we have to make this better, and there are some very specific programs that she has proposed to do that. I think the risk is Donald Trump's campaign has been one of just total negativity, basically kind of scorched earth, let's burn it all down, and I don't think that's going to move us forward.
You have said that women's health is, quote, front and center, end quote, in this election. What do you think is different about this year, if anything?
Well, I think that Donald Trump has taken extreme positions on women, not only personally, I mean, the way he talks about women, the way he treats women, but he has said certainly on health care we disagree completely. You know, he doesn't support access to Planned Parenthood. He doesn't support access to safe and legal abortion. He said he wants to punish women, in fact. And I think on the other hand, there are economic issues that certainly that our patients are concerned about. Equal pay, a profound issue in this country that Hillary Clinton has been fighting for her entire career. Paid family leave, which every other Western nation has. These are issues that I believe we can make huge progress on, and they're frankly bipartisan issues, Elaine. These are issues that the American people all agree on, and we need a president who can bring people together to do that.
I want to take a step back for a moment and just ask you about the political atmosphere going into this debate. There have been the WikiLeaks continued drip of those emails. There have been the accusations of sexual assault against Donald Trump. What is your feeling now, as someone who's been involved in the political process and on the political scene here, about what it is that voters really care about at this point?
Well, and I think what we'll see tonight, people have a choice between two candidates who have, frankly, very different ideas about how to govern and how to lead. Hillary Clinton has been specific and run a positive campaign about what she wants to do to make change in this country around jobs, around the economy, around health care. Donald Trump has run a campaign of such extreme negativity, even today, I think, in continuing to talk about things like a rigged election, which even his own campaign manager has said is not true. He is not temperamentally fit to be president of the United States. And we need, at this time, where I think the American people are looking for a strong leader, Hillary Clinton is that leader. And I think what you'll see tonight at this debate is someone who rises above the sort of scorched earth politics of the Donald Trump campaign and really talks about her vision for the future.
All right, Cecile Richards, thank you so much for your time. Really appreciate it.
Yeah, good to see you.